I guess I find when I actually use this stretch, it helps when I'm looking at some sort of facet dysfunction. What I'm really doing here is pulling the knees together. Always a good thing to really pay attention to, because when you actually bring the legs over, you'll notice that the elevation that's going to happen on the left side of the back as I pull the knees to the right is different if you have the knees spread apart and you do this. Okay? There's a big difference there. The stretch that you're going to get with the knees together is going to really intensify this. Okay? So as I'm standing here, I'm actually going to turn my back so that I actually have my hands holding his feet up. So what I'm going to do from that point is I'm just going to rotate my hands around, and I'm actually kind of braced up against them a little bit. Now this is one of those things where you got to have the rapport with your client to be able to do this. Okay? So getting permission and keeping your open lines of communication. So as I'm starting this over, I'm going to actually extend the legs out. So I'm actually feeling his hips turn against me, so I know I'm good. I'm going to turn, keeping the hands on the feet, and I'm using the flat part of the elbow to run up, probably about midway up the back. This isn't one of those strokes that's going to come from inferior to superior, and you're going to go from the iliac crest all the way up to the top of the shoulder. You're really only looking to get about midway up the back. And with the cream that I'm using here, I'm trying to just maintain enough glide to where you're almost getting a rolling effect under the forearm. And I'm actually using the flat part of the forearm. I'm paying attention, though, even though you see my arm over the spine, I'm not putting any pressure on the spine at all. I'm actually elevated above it. Okay? Then down, and I'm going to rotate over to the other side, and making sure that I pull the knees together again, getting into my position, sitting. I just have a lot of different ways that I pull the legs over. And I'm watching and feeling for him to rotate over, and I'm just going to go up. It actually should feel good. Okay? This isn't one of those things where you're kind of going in and, fighting a battle. And this, for some of us that like to use a lot of the warm-up before we get into the deeper stuff, this is actually going to be pulling that fascia out of the way so that you can't get into the deeper areas of the tissue when you're working. And I am going a lot faster than I normally would too, so just to kind of give you a reference. And I find as I do that on some of my clients that I'm actually getting a lot of relief in that mid-back to low back area that a lot of us have from that compression that we put on ourselves when we sit at the computer or driving our car or sleep on our bellies, things like that.